My name is Lucille Rivera, and I worked at Denver Health for 34 years. I retired in 2008. I actually worked on campus for 23 years. I had a variety of jobs. I actually started out as a community health aide at Westside Health Center. I loved community health. I was truly blessed to be able to advance all those years, and I strongly believe in growing your own, because that's what happened to me. I grew up at Denver Health. In fact, my children grew up at Denver Health because I was always there, of course. So, one of my children went to St. Joseph's school and for a short time, and I would have him wait in the cafeteria till I got out of work. And Eastside primarily was that was my heart. I was there for 11 years. I grew to know the Eastside community very, very well. The patients were my second family. The clinic was my second home. I always would tell my staff that when people come through our doors, you welcome them as if they were a guest in your home. We never know the circumstances of why people come in, or if they're upset, or if they're sad or mad, but it is our job to take care of them and meet their medical needs. And sometimes you even meet their emotional needs just by talking to them. People shared so much with me about their lives. I remember there was one particular patient we had, and he would call me his angel. He would come back in and say, "Where's my angel?" When I left Eastside, it was really hard for me to leave community health, but I decided after 34 years it was time for me to retire. I never retired. I actually worked at Mile High United Way for a short time, and I came to Clinica Tepeyac, where I am now. And my history with Clinica was that when it was started more than 22 years ago, I was hired here part-time to help set up the practice. And I worked here for 2 years part-time on top of my job at Community Health. And then I stepped away from that role and was a board member. I was a president of the board, and then I just stayed involved all these years. So I've had a lot of opportunity of being one of those individuals who was blessed enough to grow up at Denver Health and within community health. I strongly encourage that practice to continue, because there are so many people like me who started their families young and just were able to grow. And that's my story.